Kadangi mano kolegė Laura.
Since my colleague Laura Eidukienė is doing the accounting at the same time, so I'll chair. And opening the third session, I would like to say that we have the welcome address from Sweden. I would like to show it to you.
Dear friends, thank you so much for the invitation to your conference. It had been a great joy to be together with you, but this time it's necessary.
Atsiprašome, vertėjus pasiekė labai bloga garso kokybė, negalimas vertimas.
Dear friends in Lithuania, thank you so much for the invitation.
Brangus draugai Lietuvoje, ačiū labai už pakvietimą į konferenciją Marijampolėje. Būtų labai puiku dalyvauti, tačiau šiuo metu turiu likti namuose dėl savo sveikatos.
In December, it's 22 years since I visited Lithuania the first time. Perhaps I met some of you then. I'm very thankful for many conferences.
Atsiprašome, garso kokybė labai prasta, vertimas neįmanomas.
In Lithuania, and hope it soon will be possible for me to come back. I wish you an important conference these 2 days with many new inputs and relations. I also hope it very soon will be possible for you to translate the Linas program in other languages. So you
Atsiprašome, negalime versti, nesigirdi.
The answer from Hela Människan has been delayed, and I am sorry for that. Here in Sweden, I'm still doing some momentary work for Hela Människan and have written the program Linas Not Only Survive for adult persons who are living in codependence with family members or friends. I'm since some years employed in Uniting Church in Sweden. 3 old churches decided to build a new common church. The old one was a Methodist church, the Baptist Union and Covenant Church in Sweden. And all these are also in Lithuania. In my work, I'm supporting local churches in their progress and renewal work. I have also responsibility for brobygge, building bridges, an education with focus at dialogue and spirituality. This autumn we are working with the theme Ways to a Better World, about spirituality, solidarity and active engagement in communities. I am looking forward to meet you again and wish you blessings from God here with you in your important work. I am missing you. Thank you, Nomi.
I think Professor Nomi Tönning, we can say big thanks to Professor Nomi Tönning, and now I would like to give the floor to the representative of Belarus, Хочешь пить, треба жить, organization director Dmitry Koreshkov, who is going to deliver a presentation in Russian. And since the presentation is in Russian, the interpreter Limute Remikiene will interpret into Lithuanian, and then we'll receive a translation into English.
Хотелось бы поблагодарить организаторов данного мероприятия и вас, Альгерда, за приглашение. Это дало в первую очередь возможность рассказать о ситуации в Беларуси, не так, как это представляет наш официальный режим, а так, какова ситуация является в действительности.
Please speak into the microphone.
Prašau labai. Visų pirma,
First of all, I would like to congratulate all the participants of the conference. And in my presentation, I'm going to talk about the reality, which is going to be based on facts and how we work in the area. I would like to translate the name of this organization. It's a very interesting name. Enough drink up, need to live. That's the name of the organization.
В Беларуси проблема алкоголизации общества является самой острой, злободневной и трудноразрешимой на сегодняшний день. По официальной статистике уровень потребления алкоголя населением достигает 13,1 литра на человека в год. По неофициальным данным, эта цифра является более 18 литров чистого алкоголя на душу населения.
Baltarusijoje alkoholio
In the Belarus, the alcoholism is a very difficult one and very hard to solve in today's society. Based on official statistics, every citizen of Belarus receives 18 liters of pure alcohol per year. Official statistics says that this rate is 13 liters per year. Unofficially, this digit is much higher.
В стране по причинам, связанным с потреблением алкоголя, из жизни уходят десятки тысяч людей. Многие из них в самом трудоспособном и репродуктивном возрасте.
kiekvienais metais
Every year, tens of thousands of people die in our country because of alcohol abuse, and most of them are of productive and working age.
Причиной примерно 60% утоплений, 60% пожаров, 30% самоубийств, 50% всех дорожно-транспортных происшествий и более 80% всех убийств в год именно совершается в состоянии алкогольного опьянения. Это большую часть занимает так называемое бытовое пьянство.
It should be emphasized the reasons, the causes of alcoholism: 60% drownings, 30% fires, 50% of accidents, 80% of all homicides are committed when being drunk.
Иное отличие проблемы алкоголизации общества в Беларуси от стран соседей — это в первую очередь связано с внутренним политическим кризисом в стране. Как известно, все права на производство, продажу и распространение алкоголя в нашей стране принадлежат государству. На первый взгляд, кажется, это хороший и положительный фактор. Если, конечно, забыть о том, что вся власть в нашей стране находится узурпирована и находится в руках одного человека, а точнее правящего клана. Я говорю о Лукашенко. Лоббирование, да.
The problem of alcoholism is different from that one in neighboring countries. And society has a main difference related to internal situation. The manufacturing of all alcohol products is monopolized and belongs to the state. And this factor seems to be a positive one, because the state should take care of the well-being and health of the citizens. And that's the case in all civilized countries. However, not in Belarus. The thing is that the state, first of all, the power of the state in Belarus is concentrated in the hands of one person, of one person in Belarus.
Производитель алкоголя наблюдается в самых высоких эшелонах власти. Де юре режим Лукашенко предстает активным родителем за трезвость и здоровый образ жизни. Де-факто, как сам Лукашенко, так и вся правящая элита в нашей стране прекрасно понимают, что зависимыми и слабыми людьми просто управлять легко. Подчинив себе их волю, приучив их выполнять лишь механические функции, лишив их чувства собственного достоинства и активной жизненной позиции.
Lukashenko, as an elite in power, perfectly understands that people who are addicted and who are weak are easier to control, and it's easier to teach them to do only mechanical functions by taking their the sense of their value, of personal value. And thus the army of slaves is increasing who are ready to do the will of their masters. And this way, people will never ask for the pay rise or for the improvement of work conditions.
Его рода театр кукол-марионеток, армия послушных рабов, всегда готовых исполнить волю своих хозяев. Эти люди не пойдут требовать повышения зарплаты или улучшения условий труда. Они всегда будут довольны, пока довольны ими будут их хозяева.
Я переводила, Дмитрий, может, и дальше.
Уничтожая все самые демократические институты в Республике Беларусь, власть методично культивирует гражданскую пассивность и обособленность населения от участия в самоуправлении, в управлении собственной страной. На корню зарубаются все самые светлые и добрые инициативы, если они не являются продуктом государственной системы. Практически ни одна из независимых организаций, находящихся на территории нашей страны, в настоящее время не имеет возможности продвигать демократические идеи и ценности. И не исключением являются организации, пропагандирующие здоровый образ жизни.
By eliminating all democracy institute in Belarus, the government methodologically cultivates the passiveness of citizens, thus taking away them from the governing of the country. And this way, in practice, there is no independent organizations in Belarus recently can securely and safely practice democratic values, and independent organizations that lead a healthy way of living are not an exception.
Вот на слайде изображен график. Это, значит, 94 год, уровень потребления 5,5 литров составлял всего лишь на человека в год. И на 2011 год это уже 12,3 литра.
Ar čia reikia versti diagramą puikiai, ar ne, pateikia skaičius ir...
Maybe no need of translation because the diagram presented the data perfectly.
Вот все целеустремления белорусского обывателя, четко обозначенные его правительством. Людей буквально спаивают низкопробным дешевым пойлом. Это так называемое вино, смесь красителей, подсластителей, вкусовых добавок и спирта.
A very interesting expression by presenter Charka, which means actually a shot, and shkvarka, another term, is just a snack that is taken together with shots. And all these things are accepted by the government, and people simply drink cheap wine, which consists of spirit and various colorants.
И, может быть, в праздничной обстановке выпить. Это все произведено для того, чтобы отобрать деньги у своих детей, пойти за угол и там выпить.
It's a simple drink which is meant to simply take away the money of your families and to drink it just around the corner.
Она, в принципе, какова на вид, таково и содержимое ее.
The package shows also reflects the contents of this bottle.
Все это продается на каждом углу, рядом со школами и детскими юношескими учреждениями, рядом с заводами и другими промышленными предприятиями, где работает большая часть белорусского общества. Посредством государственного телевидения и кино людям завуалировано, но настойчиво агрессивно навязывается мысль, что пьянство – это старинная традиция нашего народа.
Jis pardavinėjamas prie
This drink is sold everywhere, on all corners, at in kindergartens, at the schools, at the companies where the majority of the Belarusian society works. Media aggressively proposes the idea that alcoholism is an old tradition of our country.
Активируется так называемое бытовое пьянство, которое, как известно, стимулирует и домашнее насилие и другие преступления, о которых я говорил.
In this way, domestic violence and domestic alcoholism is being cultivated.
Правящий режим должен имитировать некую работу в направлении оздоровления нации и противодействия пьянству. Таким образом, правительством разрабатываются и принимаются целые законодательные программы, которые, к сожалению, не имеют под собой никакой твердой почвы и не жизнеспособны в наших сегодняшних условиях. Эти законодательные нормы есть, но никто их не выполняет, потому как, в принципе, никто и не требует их исполнения.
Of course, in order to show off, the regime has to do some kind of has to show some kind of a health policy, and therefore the government develops various programs that are ineffective under given conditions. There are legal acts, however, nobody is implementing these legal acts because nobody requires for them to be implemented.
У нас пьют везде, возле домов, как я говорил, за углом магазина, возле школ, в подъездах. Исключением являются только центральные улицы крупных городов. Также среди бела дня пьют прямо в школах и на детских площадках. Но все это не особо беспокоит наших чиновников и правоохранительные органы. Для них куда важнее провести очередной день трезвости. День трезвости – это день, когда в магазинах с определенного времени не продают спиртное. То есть власти всегда заботливо предупреждают об этом своих граждан, чем еще более стимулируют и подстегивают высокий ажиотажный спрос на алкоголь.
Could you please speak into the microphone?
Išimtis didelių miestų.
People drink everywhere, with only the exception of the central streets of the streets, and the situation is really bad in the provinces of Belarus, where local people do this, like this is shown in the slide.
Стоит отметить, что иногда и среди чиновников попадаются небезразличные люди, которые видят, что страна катится в пропасть и на своих местах предпринимают все возможное для того, чтобы изменить ситуацию.
Aš atsiprašau, aš dar neišverčiau, nes pranešėjas taip pat kalbėjo apie tai, kad Baltos dienos metu.
I would like to say that people drink in near the schools, near the kindergartens, but law enforcement institutions do not care about that, about what was happening around them. They care days of sobriety, and during that day the government through the media talks about this problem. However, this information provided actually stimulates the use of alcohol, and the day of sobriety, as the presenter says, is the day when the spirit drinks are not sold.
Год назад в партизанском районе города Минска был проведен очень хороший эксперимент, направленный на оздоровление населения района. Его проведение было инициировано работниками прокуратуры района. Суть его заключалась в следующем. То есть в течение 3 месяцев на всей территории района было запрещено продавать то дешевое вино, которое я сейчас вам только что показывал и о котором говорил. То есть запрещено было его продавать, по истечении 3 месяцев были собраны статистические данные и подвергнуты тщательному анализу.
Pranešėjas pateikė
The speaker says that there are good examples in the country as well, and one of these examples is that 1 year ago in the district of Partisans in Minsk, there was a good experiment done, which was devoted to people living in that district, and in that experiment, prosecutors' office employees were participating, and the idea was that during 3 months in the whole territory, it was prohibited to sell this cheap wine the presenter was talking about and showing you, and it gave good results. And in 3 months, good results were achieved, and analysis was carried out, which is reflected in the statistical data.
Обстановка в районе изменилась в положительную сторону. Меньше на треть. Жители района стали гораздо меньше обращаться в органы здравоохранения за помощью. Решение о дальнейшем запрете продажи вот этих вот напитков было решено продлить, и за это проголосовало более 80% жителей района. Но, тем не менее, вмешался Лукашенко и раскритиковал запрет на продажу слабоалкогольных вин, назвав его неэффективным. По его мнению, это неэффективно. По его мнению, эффективно так называемое ЛТП. Это так называемые тюрьмы для алкоголиков.
šio eksperimento dėka kriminogenų
And thanks to this experiment, the criminal situation has improved. Sorry, and the number of crimes were reduced by 1/3, and fewer people addressed law enforcement institutions. However, President Lukashenko criticized the fact that these cheap wines were forbidden, and he said that other methods should be used, and he suggested LTP, that's
išvežamas gydyti.
Таким образом, режим в Беларуси
that's a forced work. That's what was an alternative method proposed by Lukashenko.
Такая вот у нас обстановка в стране, а именно со следствиями предлагает бороться.
Tai rodo
And this attitude shows how problems shows that the consequences of the problem are tackled, but not the causes.
Рождает в основном самую молодую трудоспособную часть населения. Из почти 200 тысяч человек, стоящих на учете в белорусских наркодиспансерах, почти 10-я часть это несовершеннолетние. И с каждым годом алкоголизм становится все моложе, и опять-таки не без содействия в этом наших властей.
The alcoholism as a disease affects young and productive people of a working age, and
neįskaito 1/10 dalis yra.
And out of 200,000 of those people in addiction hospitals, 1/10 of them are minors. So it shows that alcoholics are getting younger.
Конечно же, в нашем законодательстве есть статьи, запрещающие продажу спиртных напитков несовершеннолетним. И продавцы в магазинах побаиваются продавать спиртное детям из-за риска потерять работу. Но что значит все запреты, когда дети видят отношение взрослых к алкоголю? Ну, перейдите.
In our country, alcoholic drinks are sold near the schools and sometimes inside the schools. And the legal basis is a strong one, and it prohibits minors to be sold alcohol. And the shop assistants are actually afraid of selling alcohol drinks to young kids because they are afraid of losing their jobs. However, all these bans are not effective because kids see how adults use alcohol.
Запрещающие рекламу алкогольных напитков, но не нужна реклама никакая, когда вот дети заходят в магазин и видят вот стеллажи, буквально до 50%, 70% всех товаров это составляет алкоголь, вот, начиная от шампанского, заканчивая простым вот таким вот, то, что я показывал.
Children come to shops and see that on the shelves there are a lot of alcohol. There's lots of alcohol drinks. There are so many of these shelves and let's say shelves with bread and other products are really not numerous in comparison to those with alcohol.
Летним, но ничего не стоит тем же самым детям попросить не совсем добросовестных взрослых приобрести им то, что, как по их мнению, поможет им стать более взрослыми.
Of course, all these bans does not mean that a child won't go and ask somebody to buy them alcohol.
В магазины, расположенные рядом со школами, как я сказал, просто ломятся спиртного. Из окон школ дети видят, как взрослые дебоширят, пьют. Так, например, Гомельская средняя общеобразовательная школа номер 7, в 50 метрах от которой расположен магазин. Это вот, кстати говоря, вот в этом здании расположен сам этот магазин. Прямо из него выходят, на него смотрят школы, окна школы, где дети занимаются, учатся.
Another example is where you see this shop, which is called Kupalinka, is situated 50 meters away from the school.
Гомель хлебпром совсем не хлебом, а самым, что ни на есть, вот обыкновенным дешевым алкоголем торгуют. Причем, как я сказал, более половины площади занято спиртным. В магазине стоит маленький стеллаж с хлебом, со сладостями, с молочной продукцией. И когда вот, естественно, перемена, вот дети идут и все вот это вот видят. Вот это реклама. У вас то же самое, но это не значит, что это есть норма.
Once again, the idea is that children next to food see a lot of alcohol in the shops.
Организации и жителями расположенных по соседству домов было направлено коллективное обращение к депутату горсовета, на территории которого расположен данный магазин, с требованием запретить продажу в нем алкогольных напитков.
The activists who are really working on this issue and people living in neighborhoods addressed city council deputies of the district where the school is situated, and more than 300 signatures were collected with a collective address, and people asked to ban selling alcohol in this shop.
Что депутат не желает, то есть народный избранник не желает идти навстречу пожеланиям своего народа, который его выбрал. Администрация района ничего не видит дурного в том, что дети видят такую ситуацию. И, в общем, сам я общался с директором этой школы и социальным педагогом, на что она заметила: ну а что, везде же продают, мы тут ни при чем, у нас тоже везде продают и у нас.
Reviewing this request, this address, it turned out that the members of the council do not want to go to the meeting with these people who signed this address, and the shop owners did not see anything wrong in the fact that young children see people buy and drink alcohol.
Дети копируют поведенческие стереотипы взрослых и воспринимают их как норму.
Vaikai mokosi gyventi.
Children learn how to live, and they're like sponges. They absorb everything that they see in the environment. They copy stereotypes of adults and take them as a standard.
Вопиющим является тот факт, когда в день выбора депутатов Палаты представителя прямо в школах на разлив продают спиртное. Этим самым власти более чем красноречиво показывают свое отношение к данной проблеме.
Pranešėjas teigia, kad tai
And this fact says a lot. When there are elections to the council of the city, in the canteens, spiritual drinks are sold, and the government doesn't see anything wrong in that, and which shows their attitude to the problem.
Та самая школа, то есть школы, не только это одна школа, это все школы в Беларуси, они во время выборов являются избирательными участками. То есть вы видите вот вывеска «Выборы», белорусский флаг, 23 сентября. Это выборы последних депутатов в Палату представителей.
And this picture illustrates what the presenter wanted to say. And you can see this is the treatment to the people who are coming to the elections.
Доска расписания уроков. Рядом. И чуть далее, но здесь, наверное, плохо видно, символы государственной власти в Республике Беларусь. Флаг, герб и все остальное.
Another good example was happening during the elections.
Здесь видно, что родители пришли на выборы вместе со своими детьми, которые учатся уже жить.
And this is in that picture you saw parents who take their children to the elections and they see everything.
Как известно, наша страна отличается низким участием граждан в выборах, поскольку они знают, что в принципе от их выбора ничего не зависит. Но, тем не менее, зачитаю. Здесь написано: всем 23 сентября, в воскресенье, приглашает посетить буфет средней школы номер 8 по адресу улица Железнодорожная. Вас ждет широкий ассортимент продукции собственного производства по самым низким ценам в городе. Водка по розничным ценам на разлив. Будем рады каждому посетителю. Приходите, не пожалеете.
Actually, this is the quote from the invitation. And this invitation says, everyone on the 23rd of September, on Sunday, where you are invited to come to the canteen of the school on a certain address, and a huge assortment of goods on low prices will be offered for you. That includes also vodka. Working time is also indicated.
Как вы видите, это белорусские дети. Я не вру, к сожалению.
Those are the consequences.
Наша доблестная милиция, судя по снимку, она только что обезоружила злостных самогонщиков. По мнению нашей власти, это они занимаются спаиванием населения, то есть нелегально продают алкоголь. Да, в этом нет ничего хорошего, но все это направлено на то, чтобы отвести внимание общества от действительно виновных в такой ситуации.
And you see another example and pictures of policemen of how they're tackling illegal consumption of alcohol. However, the causes of the problem are elsewhere. This is just to divert the attention of the country.
Хотя, кстати, есть закон, запрещающий распитие спиртных напитков в общественных местах, но не работает. Мы неоднократно обращались к администрации города, республики с предложениями о запрете продажи спиртных и слабоалкогольных напитков вблизи школ и других учебных заведений. Мы также предлагали запретить продажу алкоголя в продовольственных магазинах рядом с продуктами питания, то есть сделать как бы отдельный вход для тех, кто хочет купить. В принципе, тут нет ничего дурного. Кто хочет купить, пожалуйста, иди покупай с отдельного входа. Вот. Но, тем не менее, власти отделываются лишь отписками и отфутболиванием наших заявлений.
We have addressed a lot of times the administrations of cities with the proposals to ban alcohol sales next to schools and other educational institutions, and we proposed to ban selling alcohols in shops. In shops, if their shelves are next to the foodstuff shelves, and we propose to ban drinking alcohols in public places.
Алкогольную информацию, то есть мы проводим периодически, так скажем, такие акции информационные.
Pranešėjas taip pat sakė, kad valdžios
the government simply makes excuses.
pusės jie nenuleidžia rankų ir, kaip matote, rodo socialinė reklama.
Washes off their hands and you can see what methods they are taking to solve the problem.
И с молодыми людьми. Ну, а вот на этом снимке здесь активистов нашей организации задерживает милиция за распространение агитационной информации, я имею в виду, связанной с алкоголем.
In this picture, you can see our activists being arrested by police.
Таким образом, такие основополагающие определения, как здоровье нации и будущее страны, являются лишь пустым звуком для большинства наших чиновников. При принятии каких-либо решений, направленных на действительное изменение ситуации в стране, они руководствуются не здравым смыслом, а боязнью и страхом потерять собственное кресло. Потому как они знают, что любая инициатива не сверху наказуема для них. Идите, пожалуйста.
This way, terms like a healthy society or the future of the country are only slogans for our authorities, but they don't make any changes, and they are simply afraid of losing their jobs, and they don't do anything. This way, they only want to prolong their existence in the government.
В Беларуси заинтересован лишь в армии послушных рабов, за счет которой во что бы то ни стало продлить свое существование, то есть свое пребывание у руля страны. И лучшим инструментом для этого был избран алкоголь и затуманенное сознание масс. Для достижения своих меркантильных, по сути, античеловеческих целей правящая элита нашей страны не жалеет ни сил, ни средств, ни людей. Как было во все времена в нашей стране, людей расходуют как расходный материал.
In order to keep their positions in the government, they chose the best instrument, alcohol, in order to achieve their goals. And in order to achieve the goals, they actually put all the efforts to do so.
Но тем не менее, мы продолжаем свою борьбу с этой проблемой, и я думаю, в дальнейшем, и хорошо, если при поддержке международных организаций, это будет очень замечательно, если они обратятся к правительству и заставят его принимать конкретные меры и действия по изменению ситуации. Спасибо за внимание. Дмитрий Крючков.
However, we continue working in order to change the situation in the country, in order to achieve changes.
Yes.
Maloniai kviečiame Algimantą.
The floor goes to Mr. Algimantas Šimaitis, a Chief Specialist of Non-Formal Education Assistance Department of the General Education and Vocational Training Division of the Ministry of Education. He is going to speak about integration of healthy lifestyle in the educational system, possibilities and challenges. Good afternoon, conference participants, organizers and guests. Thank you very much for inviting me to participate in this event and to share my experience, to listen to the experience acquired by other countries, and I see that it is very different. I would like to speak a little bit about activities performed in the educational system. Healthy lifestyle, education on health is the major point. Competence development is another thing, to make a person to be able to resist these bad habits. Health education and promotion of healthy lifestyle had its own development, and after the regaining our independence, the programs were developed of the Lithuanian Ministry of Education and Science with other non-governmental institutions. Lithuanian health program was developed. Another program was developed for 2008. And the last program developed in 2012 for child education, and we associate a lot of expectations with it. How does education takes place in schools? Competence development is in focus. Competence is the wholeness of knowledge, attitudes, and competences. And what we try to do is to make pupils acquire the necessary skills and knowledge. Generic competences which are developed in schools are laid out in the European documents, and we follow these documents just in organizing the process of education. Speaking of health education, it is comprehensive, a permanent health education from preschool age to graduation of a secondary school. Health competence is developed in preschool education and secondary education. Expression of health education in preschool education is manifested through life skills, education, self-discipline, self-control, relations with the adults, relations with peers, and cognition of the environment. If we speak about generic competences as preschool education, we can distinguish health skills, communication skills, artistic skills, and cognitive skills. In lower secondary and secondary education, the major education takes place through acquisition of personal competences. Since 2006, Lithuanian schools have the program of alcohol and tobacco use. It was approved by the Minister of Education and Science, and 5 or 6 hours are mandatory in the educational process, and the rest time is manifested through project activities, various events, and as extracurriculum activities. If we look more specifically into each age group, the development of these competencies is implemented in all stages: in elementary stage, in lower secondary and secondary stage. The pupils have lessons, but still these things are integrated into other subjects taught at schools, like ethics, biology, even physical training. The last activities performed together with the professionals and the Ministry of Health and other institutions who are the stakeholders in this area. 2 programs were developed. Human safety is one of them, and certain hours are allocated to implementing of this program. Earlier, this was more related to fire safety or civil safety, and now it covers a wider range of services, and a certain number of hours is allocated to it. Another program which was developed is a health education program, which was drafted, but we don't have hours to implement for this program. But in the future, we plan to implement this program by allocating certain hours for it. And certain schools tested this program, and schools can implement it as extracurriculum activities or as a project. And the practice, the experience acquired after such projects is very positive, and what we aim at, we just want to reduce the consumption of alcohol among adolescents. And when conducting surveys, they are conducted every 4 years, we receive the downward trend. We see the progress, but the results are not as visible as we would like it to be. But the practice shows that when the results are improved in one area, they affect other areas. If we look at the studies of 2007, 2009 or 2010, we see a downward trend. When the attention was not sufficient for these issues, the consumption started going up again. And this growth is typical not only about boys. Both boys and girls are at the same level in terms of alcohol consumption. And what we have to do, we have to think about activities and what things should be done to tackle this issue. If we speak about health education program, I would like to note that this health education program takes into account the requirements of the World Health Organization. It speaks about physical health, psychological health, and social health. And it is aimed at promotion of a healthy lifestyle. When developing this comprehensive concept, we can achieve a better results. If we look at the way this program is implemented through formal and non-formal education, the traditional form is integration into the content of subjects. Health education program is compulsory as a lesson, and it is an optional subject. If we speak about other measures which are used for implementing this program or other measures aimed at reducing consumption of tobacco and alcohol, a lot of focus recently has been placed on the issues of non-formal education, which have not been dealt with actively recently. Today, we expect that we will be successful in increasing funding for this area to make children more busy, to have more extracurricular activities for them. And education through municipalities is very different. The municipalities vary and the results in municipalities vary. This should not affect children. More focus should be placed here. If we speak about health in general, how we understand health education, at the top you see health education. And this is as well the evaluation of the process. If a child is healthy, if the school is good and healthy, we can speak that we achieved the results we wanted. But if we want to achieve this intended result, why the child should be involved, his or her friends should be involved, because all of them come to the school. School has a huge role here, because school develops the competences of a child, the behavior of your child, and the environment of the school is very important and affects the child and the educational process. That is why this holistic approach and understanding of these things is very important, and we, as well as teachers, try to convey these ideas while organizing this educational process. Briefly, that's all I wanted to say. I wish the conference good work and good luck.
Dėkojame lektoriui.
Thank you, Algimantas Šimaitis, for his presentation, and I would like now to give the floor to the Nordic Lithuanian region pupil psychoactive substances abuse trends. That's the title of the presentation. That will be delivered by Dalia Miniauskienė, a Šiaurės University lecturer.
Labą dieną, aš turbūt pabandysiu sėdėdama, nes man...
Hello, I will try... I'll deliver my presentation from my place. Good afternoon, dear participants of the conference, dear guests, dear organizers of the conference. I would like to thank you very much for the invitation to deliver my presentation here. Hopefully everyone is still alive after lunch. And I will try to present the statistical data in a very quick way so that you're not bored. Why have we gathered here? Actually, the substance abuse is one of the biggest problems of societies that pose threat to physical and spiritual health. And bad habits among youngsters, that's alcohol use, drug use, smoking. We should say that these habits are getting younger, so to say, and they pose a lot of threats to our society. And since I work in Šiaurės University, I carried out some research, and this research was carried out in 2006 and 2012 using the same methodology. In the north region of Lithuania, there were around 3,000 school children interviewed, half girls and half boys, and we use standardized data according to the questionnaire methods, according to the gender. And the respondents were 16, 19-year-old school children of 10 that were 10 graders or 12 graders, and we interviewed more or less the same number of boys and girls, a little bit more girls because usually there are more girls in classrooms than boys. So we divided the respondents into 3 big groups, and results were analyzed according to the gender and age. the biggest group was three groups were 16, 17-year-olds, the biggest group 18-year-olds and 19-year-olds. And according to the proportions, the number of respondents was very similar in the survey of 2006 and 2012. What have we seen after this survey? Well, some trends are getting better. If we take the number of school children that have tried tobacco at least once per year, so we see that this number has dropped to 5%. So we can see that preventive means are effective. However, if we look at the trends of how the tobaccos were used, whether the tobacco was used in the last 30 days, we see that the change is only, with the reduction is only 0.5%. And almost 40% of school children tried tobacco products. If we take boys and girls, we could say that we are very happy that our guys that have tried tobacco products at least once in their life, the number of such guys is getting smaller, up to 7%. And pupils who smoke are also these numbers are decreasing, which actually the situation with the girls is actually quite the opposite. The years 2006 and 2012. Sorry, so the situation is similar. If the girls who have tried tobacco at least once dropped to 3%, and those who actually tried tobacco in the last 30 days, the number increased to 3.2%, and actually it's really threatening because the girls are going to be mothers in their lives, and it's actually the situation is threatening, that the number of girls who have tried tobacco is increasing. When children try the first cigarette, and how does this age look like? We see that in 2006 and 2012, 24% of boys try the first cigarette at the age of 11 and younger. So it's really hard to imagine what kind of a person is going to develop out of this boy who at the age of 11 tries to try cigarettes. At the age of 12 we see that the number is twice smaller. From the year 13, 15, we see that the curve is very similar. The older the pupils, the fewer of them try cigarettes for the first time. The situation with girls is quite different. Up to 11 years old, at least 10% of girls tried cigarettes at least once, and the peak is at the age of 14. Around 18% of girls in 2006 and around 16% in 2012 tried their cigarettes for the first time at the age of 14. So that's the biggest percentage of this grade. Well, alcohol, well, that's we can see that it's quite actually a commodity of everyday use, and the consumption of alcohol in Lithuania is also big. And in the north region of Lithuania, pupils, almost all pupils have tried alcohol at least once. In 2006, 97%, and in 2012, 94% of pupils have tried alcohol at least. During the last 30 days, during the last month, there were 74 who have tried alcohol in 2006 and 71 who have tried alcohol in the last 30 days in 2012. What's the situation between genders? If we look at the boys, we see that the trends in the consumption of alcohol are improving. In 2012, there were 3.8 that have tried alcohol once in their life during the last 30 days, 6.8. Sorry, in 2012, 6.8%. And among girls, the statistics is a bit different, and it's quite threatening. And in 2012, there were 1.1. There were 0.5% more girls that have tried alcohol at least once in their lifetime. The age when they tried alcohol, let's say beer, which is one of the most popular alcohols, in Šiaurės region, we can see that the majority of children try alcohol for the first time in their lifetime at the age of 12 or 13. And beer is favored by quite a big percentage of pupils. I haven't mentioned at the beginning that in this survey we used the SPAD questionnaire, the same that is used in other surveys in Lithuania and Europe. And this questionnaire was used because in terms of methodology, we were able to get comparable statistics. And what we have noticed in my survey, school children were the age of school children were 16-year-olds, and in a SPA survey they were 15-year-olds. But we can analyze the situation in the north region of Lithuania. We can see that the number of children who get drunk is quite big. So in 2006 there were 87 school children who were drunk at least once, and in 2012 the trend is going down. And pupils who were drunk in the last 30 days. So we see that this number was increasing, and it was bigger in 2012 than in 2006. The guys who were drunk at least once, we see that the trends are decreasing, both during the lifetime and in the last 30 days. And the girls, actually, the number of girls who used alcohol and got drunk increased, and there were 4.5% of more girls that were drunk at least once in the last 30 days in 2012 than in 2006. Of course, and the numbers, the biggest percentage of school children who get drunk, the age is increasing. So the age is now 16. Drugs. I'll talk very briefly about drugs. As in all Lithuania and in Europe, cannabis is one of the most popular drugs among school children, and the trends are really worrying. In 2006, in Šiaurės region, 16.7% of pupils tried cannabis at least once in their lifetime, 24 in 2012. So we see that there's an increase by 9.5%. So the consumption of cannabis is increasing. Other substances, ecstasy tablets, and other drugs, the level of this consumption is quite the same. And the use of alcohol plus cannabis has also increased almost twice. So it's really worrying. And where children get cannabis, it is an illegal drug. Would it be difficult to get cannabis if they want it? And the distribution according to age groups is very similar. Almost all children said that it's easy to get cannabis, and 26% of children say that in Lithuania, in this region, it's quite easy to get cannabis. 30% said that it's impossible to get cannabis, and the majority said that they don't know where to get cannabis. So it shows that there is an access to this drug, and there is a problem of consumption of cannabis. What are the social indicators, and who are the friends of our school children? Because when we evaluate bad habits, everyone would probably agree that friends play a major role for us. And we see this as statistics of pupils who have friends that are smokers. So 63 said that they have friends who are smokers in 2006. It's just 63% of pupils said that they have smoker friends in 2012. So it means that they live in this environment and probably they smoke as well. Friends who drink and get drunk. 18% said that in 2006 said that they have friends who get drunk, and then 20% in 2012 said that they have friends who get drunk. And using cannabis. How many friends do you have that use cannabis? In 2006, there were 3% of respondents who had such friends, and in 2012, there were 4.8% of people who had friends that used cannabis. The role of parents is crucial in upbringing of their children, and the question was, do your parents know where you spend your Saturday nights? So the question was about whether they control their leisure time. And the parents of non-smokers almost all know, always know, it's 57.3%, and this number was twice smaller among the smoking children. And the similar situation is about those who used alcohol and those who don't use alcohol, and this situation is very similar among those children who haven't tried cannabis. So those who haven't tried cannabis, 54% of children's parents know where they spend their Saturday nights, and twice fewer of those children didn't. The parents of these children didn't know where they spent Saturday nights. Which is like, in conclusion, I would like to say that the numbers of girls that start smoking are really worrying, and school children start smoking at a very early age, at the age of only 11. Alcohol consumption. Girls consuming alcohol are really worrying. If guys' consumption of alcohol is getting smaller by up to 7%, the consumption of alcohol among girls has increased by 1%. And well, maybe not every one of you were drunk at least once in their lifetime, and well, almost all pupils were drunk at least once in their lifetime. Well, the tendencies are getting smaller, but if, let's say, 87% of children say that they were drunk at least once in their lifetime, I wonder how many colleagues here were drunk in their lifetime. Of course, there were more drunk girls and drunk boys. So in Šiaurės region, girls are taking the lead, and this is really worrying. Illegal drugs, we see increasing trends here. And if I remember my first survey in 2003, there were only about 5% of pupils that used cannabis in 2003. So we see that this drug is coming through to our lives. And all social aspects, that's family, friends, have a lot of influence on the behavior of our children. And in conclusion, I would like to say that in order to see smiling faces, as a specialist, I would pay the biggest attention to the families. The school, the kindergarten is in the second place. Loving children, talking to the children and families, developing their skills, just being together and knowing what they do in their leisure time are the crucial factors. And when children have good examples in the family, it's very easy to upbring them in schools and kindergartens. Thank you for your attention.
Kviečiame tarptautinę.
And now the floor goes to the representative of the International European Union Law Institute, who is going to give a presentation on the consumption of alcohol and tobacco in the international human rights law, human right and its violation. The right or its violation. Associate Professor Dalia Vitkauskaitė.
Taip, labas vakaras, brangieji konferencijos.
Good evening, dear conference participants and those who are still here, because I can acknowledge, because it's not good to be the last presenter before the coffee break, because it's difficult to maintain the attention. It's difficult to give this presentation or try to present it because it's provoking. When we were speaking about the topic with Mr. Algirdas, we discussed, and my aim was to provoke a discussion whether we really, while trying to protect the right, when you protect the rights of children you try to save people from drugs, children from drugs, whether just to look whether it is allowed by law or human right law. We have a lot of laws and rights, and it is the question to what extent we can limit these rights. And I like the first presentation and the idea that in Finland, Finland is going to become a smoke-free society till 2040. And when I was listening to the presentation, it's a very nice idea, but whether is it possible? And we should speak about this feasibility. When we speak about the environment, smoking in public places, yes, maybe it's possible. But when we speak about balconies, somebody just would say that it's my balcony and I must be allowed to do what I want to do there. And my aim was to show, but not all rights, but some of them have a certain antithesis. At least it's undergoing the formation. And where do you find this antithesis? And is the right to your life. There are two cases, pretty case, which will be introduced to you. And it seems is not based on the wish of a person to survive, not because of this death penalty or killing while arresting. It's the case which questions the right to life. It's concerns with a woman who has a very rare disease and she wants to die. Earlier, we did not have cases like that. At least the European Court of Human Rights did not have many of such cases. The technologies have been improving and the human life is extended, so we can sustain it in one or another way, or just to make this survival easier for 10 or 15 years. Doctors know this area better, but the fact is that there are people who want to die. I don't want to live like that, I just want to die. But I can't alone. Please allow my husband to help me to die. If I'm not mistaken, several years ago, we had a mother who just injected a fatal dose for a child. If you remember, there was a problem that a mother was arrested according to the penal code. And the mother said that I don't want to live. If we go back to the case in the United Kingdom, she asked the court not to punish her husband, to help her to die, in order to help him to help her to die. So the phrasing, the wording of the ruling of court should be very careful. So the court said that right to life should not be interpreted as an opposite. It should be seen as a right to die as well. So the ruling of the court was also criticized, but at that moment they said that there is no such right. Okay, we have the right to life. We have one case, and we see that in 2009 we see the Koch case. This situation is very similar. The scenario is the same. A woman wants to die and her husband wants to help her. The court doesn't want to consider this case, and the woman committed a suicide in the country where it was possible, and the court was glad that it did not have to deal with this case. We don't have a lot of such cases, and there were not many cases at court which consider the right to alcohol consumption, the right to smoking, maybe because such rights are considered or looked into international courts. But when we have these cases, the jurisprudence of courts is very poor. The question is whether we have the right to health. Yes, we do have it. It exists, and it exists in the majority of international documents. And you would say that yes, we do have the right to health, the right to healthy lifestyle. And there is a need to form the right like this. But if we take the catalogue of the Convention of European Convention of Human Rights, the things that are dealt with in Strasbourg court, you wouldn't be able to find such a right. It is the result of other rights, for example, from the right to clean environment, from other aspects, but we do not see a specific right to health. And if we see what cases court deals with, right to smoking or ban of smoking would fall under the category of environmental category rather than health category. So it is related to pollution, and the court wouldn't consider to what extent smoking is harmful to health. If we raise this issue, if we ask the question whether trying to restrict human right, I question this right. I'm trying to provoke you, because at a later stage we will see whether the court sees such a right. So the question is, when can we restrict this right? Can we tell a person you shouldn't smoke, you can't, smoke in your balcony? one can restrict smoking in public places, but it's impossible to restrict smoking in private balconies. For example, John Stuart Mill, in his work about freedom, when speaking about the principle of harm, says that the only case when the certain rights can be restricted when these habits or actions are very harmful to another person. The European Court of Human Rights says, okay, let's apply several articles to it. And so what are these articles? It's the second article, which protects the right to life. The right to life is related to smoking because smoking can affect another person. Particularly passive smoking is very harmful. The second article is torturing, is related to torturing. When we breathe in smoke, or when we feel this when people just quit smoking, they feel physical symptoms which are not very pleasant. So the question is whether we deprive a person from smoking, maybe this person will not feel well. And the third article is related to private life. If I have a private flat, I can do whatever I want there. Speaking of when restrictions of human rights, we speak about the fact to what extent the state can contribute to these restrictions. And the jurisprudence showed that the state can interfere with private life. So what's most interesting? So we have several examples. We have Lithuania versus Poland. When we arrest a person, a drunk person in a public place, and we take this person to a certain place to make this person sober, and this was the case in Poland when an elderly person was drunk and he was detained for 6 hours. This person just was drunk, he didn't do anything wrong. This person wanted to protect his rights, and he was lucky because the court stated that this person caused no harm, he was just drunk, he was sober after 6 hours, and these 6 hours was the period a too long period, because it's not necessary. We can detain a person if this person aggressive towards others. And other cases, Floria, Feriadis, the cases in Romania, and the European Court of Human Rights has never had such a case of smoking. They had only a case related to passive smoking. So the factual circumstances in these cases are the same, and the persons were detained and they were separated from the non-smokers, and their health became much worse. For example, the effect of cigarettes affected the health of another person. So it was proved that the actions of Romania, I mean that smokers and non-smokers were not separated, and the failure to protect the rights of non-smokers presupposed torturing and inhuman behavior. So, besides the premises where these detainees were kept were very small. If we look at the last case, this case is related to active smoking. When a person is kept in hospital, and at that time the patients were allowed to smoke within the premises. And at that time a law was passed that it was forbidden to smoke in premises. And this person said that he couldn't go out to smoke because he was not allowed due to the treatment regime. And there were no smoking premises in this hospital. And this person said that his right to smoke was violated. This case does not reach the European Court of Human Rights, and there is no such right as the right to smoking. And despite the fact that a person has such needs, so the English court said that such right does not exist. It seems that everything is allowed in England, but still we can't speak about the right to smoking. If we speak about the trends of the developments of human rights law, most probably it will be related to restrictions on human rights. We can restrict human rights when the health, welfare of the society are damaged, and welfare and health in the society is very important. And if we see questioning of right to life, maybe after some time we will start speaking about the right to smoking. I want to stop here and would like to just point out that there is no right to smoking, but changes might be possible in the future. Thank you for your attention. Thank you very much, Dalia Vitkauskaitė. I was listening to her presentation in presentations in her seminars, and I wanted to invite her to this event. That's why she gave a presentation here. And now we have some time for questions. We have 10 minutes for questions and discussions. But I would like to give a piece of information that all presenters, all speakers who will participate in the conference tomorrow, they are going to be accommodating in this hotel. And the participants will be accommodated in the youth center of Vilkaviškis diocese. And one more thing, that all participants have a draft resolution in the material handed out to you, and I would like just you to just look through the resolution, draft resolution. Maybe you have any proposals or suggestions. And now maybe you have questions for the speakers.